Right now on Up with KREM, we have heard from you at home. Getting a COVID test right now in Spokane is like pulling teeth. So this morning, we're sharing the newest requirements for getting a test and telling you more on if the state plans on bringing a larger testing site back to Spokane. In Washington, hospitals say they are almost at their breaking point.
They are doing things like turning areas not meant to be taking care of critical care patients into ICUs.
This morning, why Washington health leaders are questioning decisions made by our local politicians.
And we're going to take you outside, talk a chilly start to the day before another storm moves in.
Up with KREM begins now.
The Washington State Department of Health says state resources are spread thin. After the latest briefing from the department, Dr. Umair Shah took to Twitter to plead with Washington residents to get vaccinated. This morning, we're talking about how the surge in COVID cases is affecting our local resources. Good morning and thank you for joining us on Up with KREM on this Thursday morning. I'm Channing Curtis. Right now, Washington is seeing the highest rate of COVID-19 cases and hospitalizations since the beginning of the pandemic.
Our resource hospitals in places like the Tri-Cities and Wenatchee and Everett and Vancouver, as well as Seattle, all of them are going to incredible lengths to care for their patients. They are doing things like turning areas not meant to be taking care of critical care patients into ICUs.
Right now, 1,592 patients are hospitalized with COVID-19 in Washington. State Health Secretary Dr. Shah says hospitals are experiencing extreme stress, but are not in a crisis standard of care like in Idaho.
So our goal is not to get there. This is largely preventable. This is about wearing masks. This is about getting vaccinated.
During Wednesday's briefing, officials said despite a number of cases among students, they're not seeing large outbreaks in schools. Now in Spokane, hospitals are reaching ICU capacity, and now local doctors are speaking out. Chief Medical Officer at Providence, Dr. Dan Getz, was clear that our hospitals have never been more stressed. He's now speaking out against people who say that getting vaccinated against COVID-19 is a personal choice.
And I hear the argument over and over again that it's a personal decision, but I'll tell you, it's not a personal decision, because if you require hospitalization and care, it's taking care away from that patient with cancer that's waiting to get that removed. It's taking care away from that patient that he needs their hip or their knee replaced. This impacts us all. It's a population health issue.
He also says there are 18 patients in Providence's ICU on ventilators, and not a single one is vaccinated. A frustrating fact for many physicians because they say that none of those patients would have been in the ICU if they had been vaccinated. Now, other Spokane health officials all are agreeing with his statement. KREM was able to speak with several doctors yesterday, including Spokane Dr. John McCarthy, who works for the Native Project. McCarthy was also the former health officer of Okanogan County.
I can decide to go shoot people. That's a personal choice, but it's not a very good one.
Both doctors question why the Spokane County in-state fair is still happening. We reached out to each of the Spokane County commissioners, their offices, as well as the health district office and interim health officer, Dr. Frank Velasquez. Commissioner Josh Kearns did respond, saying that, quote, our community has had so many events taken from them over the last 18 months, end quote, and that the commissioners met with the Department of Health and the health district to make sure that the event was safe. He also says that masks are required per mandate, and there are additional hand washing stations as well as additional seating for social distancing. But the doctors are saying this is not enough.
I'm incredibly concerned that we have a big fair going on in Spokane. That makes zero sense in the middle of a pandemic.
That's a real tragedy that we are determining health by politicians rather than physicians.
Interim Health Officer Dr. Frank Velasquez says he stands by the decision to continue on with the fair. Now, one place state leaders say they are seeing outbreaks is in long-term care facilities. 6 facilities in Washington's Tulalip and Jefferson counties have had outbreaks, resulting in 9 deaths in just the last few weeks. Health leaders say the main source is coming from within the facilities.
Unfortunately, all of the large ones involve unvaccinated staff. We're really seeing that is the #1 way that COVID spreads far and wide within these facilities.
The governor's vaccine mandate for all state healthcare workers is expected to help, but there's still another month until that deadline. Now this morning, we want to hear from you. With many doctors saying that they don't believe getting the vaccine should be a personal choice due to the impact unvaccinated COVID patients are having on our hospitals, we want to know what you think. Do you agree or do you disagree? You can vote right now in our Twitter poll, or you can also text us what you think by texting 509-448-2000. We've already had several responses this morning. Some people saying absolutely agree, 100% love thy neighbor. Another person says not getting the shot is just plain stupid. On the opposite end, people are saying yes, it should always be a personal choice, freedom in the USA. Or yes, personal choice, just like every single other vaccine. Again, you can always vote right now in our live Twitter poll, and you can also text us your comments just like these other people did at 509-448-2000. We'll be keeping up with your comments all morning long here on Up with KREM. Now, if you tried to find a COVID-19 test recently, you've probably been hard-pressed to find any available appointments. And this isn't just a local issue, but a regional one. So Nicole Hernandez is joining us live right now. She has talked to local health leaders about their plans to continue COVID testing in our area. Good morning, Nicole.
Yeah, good morning, Channing. So right now I'm live at the Spokane Arena, where, if you remember, this used to be a huge COVID-19 testing spot, the biggest in our area actually. But now COVID-19 tests are hard to find, and when you do find them, they're booked out pretty far. So I was able to talk with the Spokane Regional Health District about whether or not they're planning on putting out new mass testing sites in the future. So they said that SRHD is actually working with the Washington State Department of Health to try to set up drive-through community test areas. They're asking for that to happen as soon as possible, but SRHD doesn't know when or if it's actually going to happen. So we went straight to the source. The Department of Health says as of right now, they're actually not planning on opening up more free mass testing sites like the one we saw at the Spokane Arena.
There are a number of tests now available to be done at home. You can pick those up in your local pharmacy. You can also order some of them online from online vendors. So those are rapid antigen tests that you self-administer at home, and that's a great resource for families to have on hand.
The Department of Health says the federal government could be stepping in to help across the country. DOH says that they have some community-based testing sites across the state, and they're hoping to have more of those open up soon. But the whole system right now is really strained. So to help the community, as a community, we need to get COVID-19 cases down. That means getting vaccinated, wearing masks, and social distancing. So if you do need a test, though, in this time of having these testing shortages, the Spokane Regional Health District says specifically if you need a test because you have COVID-19 symptoms or you were exposed to COVID-19, you should be calling your doctor's office. And if you need a test specifically just for events or travel, then you should be reaching out to local pharmacies or using those at-home tests that we mentioned. In Spokane, I'm Nicole Hernandez.
All right, thank you, Nicole. Now we know this has been a lot of information to take in this morning. So if you would like to read more about any of these stories, we're making it easy for you this morning. All you have to do is text the word COVID to 509-448-2000. We'll send those articles and all of the information that we have right to your phone. All right, it is 7:38 right now. Let's go ahead and get a look at the forecast. Jeremy, listen, so I woke up this morning, I was chilling, had my fan on, stepped outside.
Yep, okay.
It was cold.
Yeah, for me, I look at a morning like this and I go, this is how I keep my skin tight. You know, you get out of the shower, you step outside and you go, whoa. Yeah, I don't know if that's actually true, but yeah, hey, I know, right? This morning it is a little bit chilly outside, and it's the case across much of the inland Northwest. Down to 30 in Deer Park, 30 in Newport as well. Sandpoint, you're up to 37 now with a little sun coming up. 42 in both Spokane and Coeur d'Alene, but all around the region, we did find pockets of temperatures falling below freezing or into the 30s and a little bit frosty. And that's the reason we have the freeze warning and frost advisories in place until 8 a.m. This lasts for another 20 minutes. It's likely they get extended a little longer with some of these temperatures staying a little bit cooler. But right now it's clear skies overhead and these cool temperatures. All day long we're going to stay a bit cooler than where we should be. By this afternoon we top out in the mid to upper 60s. That's almost a 30-degree rise in temperatures. So it's a big jump, but still quite a bit colder than where we should be this time of year. And this all comes ahead of our next round of rain.
A new robocall scam is targeting seniors.
They're telling them that they need a new card.
How people can avoid giving out their personal medical information. And a social media post just might lead you to South Dakota. We're hearing from a Spokane woman who began a mission to help people she's never met before that live 1,000 miles away.